Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth Ejection Fraction Secrets That Could Save Your Life, and trust me, it's juicier than your cousin's peach cobbler. What if I told you there's one number that could predict your heart's future better than your blood pressure or cholesterol? I know you're thinking, Dr. Tauth, here you go again with your dramatic doctor talk. But hold up. Today we're diving deep into ejection fraction, the heart metric most people have never heard of but desperately need to understand. Seriously, this stuff keeps me up at night because I see patients all the time who could have avoided major problems if they'd just known about this one simple measurement. So, what exactly is ejection fraction? Think of your heart as a really muscular guy trying to squeeze every last drop out of a water balloon. Your ejection fraction measures how much blood your heart actually pumps out with each beat compared to how much it's holding. It's like asking, hey heart, you've got a full tank of blood in there. How much are you actually pushing out to do some work? Normal ejection fraction runs between 50 and 70%, meaning your heart should be ejecting at least half the blood it holds with every single squeeze. That's pretty impressive when you think about it. Your heart's basically saying, I'm not keeping this blood for myself, I'm sending at least half of it out to feed your brain, your muscles, everything that keeps you ticking. But here's where it gets scary. If your ejection fraction drops below 40%, we're looking at serious heart weakness that needs immediate attention. And I mean immediate. This isn't a let's wait and see situation. This is a maybe I should see you in the clinic, we need to talk kind of moment. I always tell my patients that ejection fraction is your heart's report card. Just like in school, you want good grades, not barely passing ones. Your heart doesn't get summer vacation to improve those grades later. Now, why does this number matter more than you think? Here's the kicker, and yep, entirely true, I can't make this stuff up. Low ejection fraction often shows up before you feel any symptoms. Zero symptoms. You could be walking around feeling fantastic, crushing it at the gym, bragging about how great you feel, while your heart is quietly struggling and sending up flares that only we doctors know how to read. It's the earliest warning sign of heart failure. And trust me, heart failure is not something you want to discover the hard way. Doctors use ejection fraction to determine medication dosages and treatment plans. We literally base life-saving decisions on this number. Insurance companies even consider it for coverage decisions, which tells you just how important they think it is. When insurance companies care about a medical number, you know it's serious business. Catching a low ejection fraction early can literally add years to your life. Not months, not weeks, but years. Quality years where you're still arguing with your spouse about the thermostat and complaining about your neighbor's dog. Let me tell you about Sarah. She's 52, came in for her routine checkup feeling absolutely fantastic. Sarah's the type who does yoga, drinks her green smoothies, posts motivational quotes on social media. Her blood pressure looked beautiful, cholesterol numbers were stellar. She was ready to walk out of there with a gold star on her forehead. But then we did her echocardiogram to check her ejection fraction, and boom, 35%. Sarah's jaw hit the floor harder than a dropped phone with no case. Here she was, feeling like Wonder Woman, but her heart was quietly struggling. We started her on heart medications immediately, and she completely revamped her diet. No more messing around. 6 months later, her ejection fraction had improved to 45%. Sarah literally avoided what could have been a massive heart attack because we caught that number early. She still sends me Christmas cards with pictures of her grandkids, and every time I see those cards, I think about how different things could have been. So here's what you need to do, and I'm talking to everyone listening right now. Ask your doctor about getting an echocardiogram to check your ejection fraction. Don't be shy about it. This isn't a weird request. It's a standard test that gives us incredible insight into your heart's actual performance. If you're over 50 or have any family history of heart problems, you need to request this test at your next visit. Don't wait for your doctor to suggest it. Be proactive. Walk in there and say, I heard Dr. Tauth talking about ejection fraction, and I want mine checked. Trust me, your doctor will be impressed that you're asking smart questions. Knowledge of this one number could genuinely save your life. It's that simple and that powerful. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.